Hi, welcome back to Daytime Ottawa. I'm your host, Barbara Balfour. Our feet can take a lot of abuse, sometimes without our even realizing it, and in those cases, sometimes a salon pedicure just isn't enough. Here to talk to us about how to take care of those tender tootsies is Kirsten Hansen from Kirsten's Foot Care. Thank you so much for joining us.
Thanks for having me.
So tell me a little bit about your business. What is it that you do?
So myself and the nurses that work with me are registered practical nurses or registered nurses that have actually taken continuing education in advanced foot care and advanced diabetic foot care. So we've basically specialized in taking care of people's feet.
So why is it important to have that extra credential as a nurse to take care of feet?
Well, especially if you're a high-risk person, not that foot care is only for high-risk people, but if you are high-risk, like you have diabetes or you have heart conditions, your risk for infection is so much higher. And if you just go to the everyday pedicurist or even a regular nurse, they might not know how to take care of the potential problems that you might have.
So what kinds of problems would someone with diabetes or heart disease have with their feet that may not necessarily affect the rest of the population?
So a really big thing is they will either get really dry, cracked skin, and that can open up, it can bleed, cause infection, or they can have a lot of problems with swelling. So swelling sometimes is a big symptom of heart failure. And people don't necessarily realize that. They think, oh, my feet are just swollen, they're holding in water, but sometimes it's much more than that.
And have you seen cases like that in your business?
Oh, definitely. We've sent people to the hospital from our clinics before, and we've been happy we did.
Wow, that's incredible. That's incredible. So the feet really are kind of like an alarm bell for what's going on in your body.
Definitely, and even something as simple as an ingrown nail can become a really big problem if not taken care of properly.
So how many facilities do you have?
So we just opened up a clinic in Orleans 2 weeks ago, just off Innocent 10th line. So we have our main location there,
okay.
But we also do mobile visits. So we come to people's homes.
Okay.
So we like to, I'm 50-50 with both, but we like to offer both in-clinic setting and in-home setting, depending on what our clients prefer best.
And is it covered by healthcare?
So insurance companies will often cover it, or even on income tax. Unfortunately, it's not covered by OHIP anymore, but there's usually ways that it can be covered, and people work from there.
And what sorts of clients do you typically see?
So we see everyone. I mean, a large group of our clientele is seniors, but we see clients in, even my age, young adult, middle age. Our youngest client was 12 years old with an ingrown toenail. So foot care really is for everyone.
Wow. And I remember when I was traveling abroad, I would see advertisements for medical pedicures. Is this basically what you offer? You would call it a medical pedicure?
So I think the doctors would get kind of mad with us if we say medical pedicure, but yes, in a sense, yes, it is medical pedicure. We don't soak feet because it's an infection control issue.
You don't paint nails,
We
obviously.
don't paint nails,
yeah.
exactly.
Yeah.
And it's provided by a medical healthcare practitioner.
Okay, great. And what kinds of services do you offer?
So, like I said before, we do come to people's homes, so we provide in-home foot care as well as in the clinic. We do have some community centers we go to. We have nail reconstruction, which I actually have a before and after photo of.
Yeah, you sent us an image that we could throw up on the screen there of what happens when someone's damaged a nail pretty badly. We can see it up on the screen right now.
Exactly.
And what you do to reconstruct it. So the nail does grow back eventually, but it takes a really long time,
It can take a long time. So the picture above is actually of a marathon runner that lost her nail.
Wow.
But if someone has fungal nails, obviously it's not always pretty to look at. So it's healthcare, but also in that sense that it is meant to look a little bit prettier.
So, I mean, this is like an art form. How do you reconstruct a nail?
With specialized gel resin. We also have podiatry tools, drills, that we use to take down the nail. And it is a little bit of an art form for sure.
Yeah.
Another thing we do is for those pesky ingrown nails, we have nail braces, which I have a picture of as well.
Okay, yeah, maybe you could pull that image up on the screen now of a nail brace. And so to need a nail brace, you need to have an ingrown nail?
or one that just has a higher curvature than normal. So not everyone is blessed with very flat nails. This
So
photo,
that's it right there?
yeah, that's just the nail brace being applied. It's actually glued to the nail, and what it does is it helps pull both the edges up, so they're not digging into the sides of the nail of the skin anymore, I should say.
So is an ingrown nail when the nail curves into the skin, and then what happens, like the nail starts growing further into the skin?
It starts growing further into the skin. It can cause swelling, discomfort, pain, sometimes even infection if it's not taken care of right away.
Now, it's something that's pretty easy to prevent at home, is that right?
Definitely.
And you actually brought us some tools.
I did.
What people can do at home.
The average person is not going to have a individually sterilized pair of nippers like we do. All of our tools are sterilized with an autoclave, which is the same machine the hospital uses. So
It's reassuring.
Yes,
Yeah.
I just want to make sure that everyone knows that. But you know what? Picking up a pair of clippers at your local pharmacy and trimming your nails straight across rather
Always
than on
straight
a
across.
curve.
So don't ever round your toenails.
No, if you cut them down the sides, you're immediately putting yourself more at risk for an ingrown nail. And making sure you file those nails. I know that's one thing that a lot of my clients they just can't do it. But it's really, you'd file your fingernails, so file your toenails too.
Okay.
And we talked about dry cracked skin before.
Yes.
You can go to your local pharmacy. I picked mine up from the PharmaSave, and this little file can do a lot of good. You just take it to the side of your foot or your heels before your shower or your bath.
So should your skin be dry or damp?
I find it's more effective when it's dry.
Okay.
In that way, you get into your shower or your bath, you just wash off all the debris, we'll say,
Yes.
and you've got nice smooth feet.
Okay, so you're obviously not a proponent of those shavers that you see sometimes in salons for calluses.
No.
Yeah.
No, I'm not. Especially, again, it's a huge infection control issue, and you can go way too far. We don't use them in our practice. We use the podiatry drills, so electric files, and they're risky for sure. But one thing you do after the lovely file is make sure you put on some lotion.
Okay.
These are 2 lotions we carry at our clinic, but even something simple from Canadian Tire like O'Keeffe's.
O'Keeffe's, okay,
Yes.
so where would you find that?
Well, as seen on TV, so Bed Bath & Beyond, Canadian Tire, Home Depot. I know it sounds strange for a foot product, but they've got a hand cream, a foot cream, and a body lotion, and they're very reasonably priced. So they work, and that's the important thing.
Awesome, so some really simple things that you can do at home from a preventative standpoint.
Definitely.
Wonderful, and where can we find you?
So we can be reached at kirstensfootcare.ca, on Facebook at Kirsten's Foot Care, or of course at our clinic on Vantage Drive in New Orleans.
That's wonderful. Thank you so much for coming in.
Thank you for having me.
Wonderful.